This is the video that shows patients how to use the Enlighten Teeth Whitening system. So this is for the home whitening. Grace, you can take over and show us, please.
Okay, so every patient's whitening trays come in a box like this. When the patient has not got the whitening trays in, they must remain in the box. So once they're cleaned after nightly wear and use, they must remain in the box. All right, so they are whitening trays. They're quite squishy. So once they're in the mouth, they're very, very comfortable and they're very nice to sleep in. All right, that's the same with upper and lower here, and they both fit in the box just like that. All right, so if I was to ask the patient to try the tray in first, I will hand the patient the upper tray first with some light, just to make sure that that fits well for them.
That was easy.
Perfect.
Perfect.
Same again on the lower then. Perfect. Feels nice and seated for you. Good.
Perfect. Fits nicely. Brilliant.
Excellent. So we can take that out because I'm going to demo on my own tray here. Okay. So yours is nice and clean. Perfect. Well done. So I'm just going to lock that and pop that back in your box. So if we just begin with the whitening here, I'm going to get my own tray open here. This is my demo tray. So although it's a little bit harder than what you have at home there, it is the same principle in how to load the trays for you, okay? Yep. So if I was to get my pretend whitening syringe here, this is just a syringe filled with toothpaste, but the same principle applies when whitening and loading your trays. So if you just have a look here, when I load a tray, I get the tip of my whitening syringe right at the corner of the tooth here, and I would only fill the tooth to about a third, because if you think about it, your tray is squishy, so once it is seated into the mouth, some solution may spill over the top there. So when that happens, people do often overfill the tooth to quite, till it's quite full, and then they're just losing their solution, so it's a waste. So only fill to a third, and it's your choice how far back you go, whether you want to whiten every tooth all the way to the back, or you just want to stop where you stop smiling and stop showing those teeth. That is completely your choice. But you should have plenty of solution to do your 14 nights consecutive. And what I'll do is I'll show you what your kit looks like now.
Okay.
All right. So that's the same with upper and lower, exactly how you load it. So this is your Enlighten whitening box, okay? This is the sleeve. I'll get rid of that for you. But I want to just bring your attention to, at the back of the box here, you can see that that's a fridge pack. And what that does is, even on your journey home, it keeps everything nice and cool for you, because this must remain in the fridge. It just gives it a longer lifespan. So do remain in the fridge with that, all right? So when I open your box here, you can see that there's two syringes. One is a kind of white clear solution, and one is slightly green. That's because they're different percentage strengths. So I always like to begin with the clear solution here. It's a 10% on here, and you can see that it hasn't got a tip on it yet. So that'd be jolly hard to get your solution right down to the corner. So what you do is, on the end here, you twist and pull that off. And then can you see just here that this is a tip for you? I can never get these out. And then what you do is you twist that on, and only when you're ready do you snap that end off, all right? And that releases the solution for you.
Perfect.
If I put that back together so it's neat for you. So always start with your 10%, because can you see here that there's indicators? And each one, there's 7 indicators there, so it should be 7 nights of solution for you in this one syringe, and then 7 in that, so 14 nights. We find that you may use a third of an indicator per night, or 3/4. It just means you may have some left at the end, which is never a bad thing. No. But that just is a good indication of how much to use. If you use less, that's a benefit to you, all right? Okay. So then you can see here the greeny colour. This is a slightly higher percentage at 16, and we always like to kind of finish off with that one. So upon night 8, you'll be loading your trays just like you would with this one, and you wear it all night, 8 hours, if you get that much sleep, let's hope. But this will finish everything off nicely for you, all right? So if you are particularly sensitive, maybe you can't quite crunch into ice cream, you may find that you have a slight bit more sensitivity during this treatment. And what these are here, if I can get them out, these are, can you see that says desensitizing swabs?
Yeah.
And what these are is they look like earbuds, but can you see they've got a little green line there?
Yeah.
Which you snap it on that green line, and it releases the fluid, and it releases it to the end there where you can rub it. Say for example, if I show you on my tray. Do you mind, Tyler, if that's okay? How do I get in it? I do, don't I? Okay. So I won't snap it for you, Tyler, but I'll just show you what to do.
Okay.
Good God. I hope you've got fingernails. There it is. Okay, so that's what they look like.
Brilliant.
So if I was to pick one
there's
up,
liquid inside of
yes, you can see the fluid.
Yeah. And just show you where you do it, because you're wearing gloves.
Sure.
So you would literally be a bit brutal and literally snap it to the side.
Snap that where that green line is, because then it releases that fluid to the other end. So for example, if you have one tooth or one area of a tooth, I'll just demo on my tray here, that you know is a little bit more sensitive, you would in the mouth just rub mostly on the edge of the tooth with the solution, and on the upper part of the tooth where the gum is. That's where it is usually most sensitive. So you can do that on some teeth if you prefer. Oh, it's better with this model. So for example, if it's this front tooth that you're getting more sensitivity, sorry, I've got shaky hands, then you just rub the cotton swab on the end of the tooth here, and on the top there by the gum line, and that should release that sensitivity for you as well. All right?
Yeah, lovely.
So, the very last thing I'll show is, well, that's going to do me in if I do that the other way around. Good. Right, that is all nice and cold in your pack.
Yeah.
And then you keep that, as I said, in the fridge with your tray. That's often the best way.
Just for transport.
Yeah.
It's more like in the summer when it's really warm.
Yeah.
To get make sure
Exactly.
Exactly.
Because
you don't have to keep it in the fridge, otherwise it doesn't work. No, but you don't want it to be in a warm car where it warms up. Okay. Then it just loses its effectiveness. Did you demo the filling of the tray as well?
Yes.
With the toothpaste?
Toothpaste.
Can I just see that one?
Of course you can. So
I would put that behind this so you can see the black. And now let's put some toothpaste in there.
So I hope it comes out because it's quite thick toothpaste. So Tyler, here, if I show you, like I mentioned before, just on the edge of the tooth here, if I push quite hard with this, it might come out. I picked the grainy toothpaste, didn't I? Oh, here it comes. So there's a little bit coming out there. Can you see? I'm just filling it up to about 1/3 of the tooth.
Go push really hard with that.
Yeah.
I know it's much easier to do that with the trays.
Good God. Sorry.
So this would be a lot easier.
There you go. You won't have to fight with it. But that's just demonstration there with some toothpaste. I would fill just to about that much on a tooth.
Okay.
I think that's very fair. Can you see that there? Yeah?
Yep.
I think that any more than that, it will squodge out.
There we are. This holding steady is quite small. There you go.
Good.
Good, thank you.
Okay, I'll wash that out in a second.
Thank you.
One last thing. This comes with every patient's Enlighten trays and Enlighten pack. It's desensitizing toothpaste. It's also a very nice toothpaste, but we give it to every patient as well because if they are experiencing more sensitivity, it's best they have a sensitizing toothpaste for them as well. All right?
Yep.
So that goes in your box as well, along with everything else. You're all packed up.
Yep.
So when you get home, just pop that back in the fridge for yourself, and then it will just be a reminder that tonight, just before you go to bed, load that tray, pop it in the mouth, sleep with it. The one last thing, I will mention is just how to clean the whitening solution out of the trays, because obviously you don't want to just keep lots of solution once you've been sleeping in it. So if, for example, I touch this tray here, you can see it's quite flimsy. So once the solution is in there and you've slept in it, it's quite goopy. So what I do is I run it under a cold tap and just massage it out of there, and that will be plenty enough. If you find that just at the front here you can't quite get in there, just cold water and a toothbrush would be plenty.
Okay.
Try not to use any toothpaste because it is quite abrasive and will scratch your trays. All right?
Yep.
That's it. Tyler, do you have any questions?
No, I think you covered it all. Thank you.
Jolly good.
Last thing is just to say what happens next time. Absolutely make sure to next time when you come when we're doing the
yes.
in-office. We're seeing you in 14 nights from now, so 14 days. That's right. Make sure you bring those trays with you. Okay.
If they're not with us on your appointment date where we seal you off, we can't do anything. No. We've had patients travel and they go, oh, I left it on the kitchen side. There's nothing we can do for that appointment, all right? Yeah. So it's really, really important that they come back to us, all right? As far as diet, we do suggest that you stay away from things like heavy use of turmeric or curry powders, or say, for example, you love a curry and you're having it lunch and dinner. I would try and stay away from that just throughout your journey until you're sealed off, because it's not proven that it does stain the teeth, but we do like to have more of a liquid, white diet, not a lot of red wine, not a lot of very heavy coffee, black coffee use. So just be aware of your diet for this 14 nights. Once you're sealed off, you'll be absolutely fine. Have all the curries. Okay. But just while you're in treatment, all right? Yep. But just bring the trays for your subsequent appointment. The receptionist will make that for you. But that's it.